Our discussion will be on introduction of white blood cells, normal values, classification, morphological features, functions, and physiological pathological variations. My first question to you, why there are how many types of cells you will find in the blood? How many? Three. Who is among these three group of blood vessels whose numbers is less? Comparatively less. Either it is platelets or WBC or RBC and number is highest?
Highest is RBC.
Highest RBC or platelet? RBC. Why leukocytes are given such name? I understood RBC, erythrocytes has been given this name because of they contain red pigments. But why this name has been given to leukocytes? This name, leukocyte term is given. Anybody? There should be some reason, isn't it?
Because it contains clotting factor.
Contain?
Clotting factor.
Huh?
Clotting factor.
WBC contains clotting factor.
WBC no, sir.
Then?
Platelets.
I am talking about WBC, white blood cells or leukocytes. Why this name has been given to it?
Leukocytes.
Leukocyte name has been given to it.
Because the which is a red color to the.
No, red color. WBC is
Red color to RBC.
and this is not having any color.
No, not
Okay.
hemoglobin.
Okay. Hemoglobin. WBC is having hemoglobin.
It is absent of hemoglobin.
Okay. Now tell me, what is the cause? Why are they called white blood cells? When we centrifuge heparinized blood or having anticoagulants, when we centrifuge it, then we see cells are at the bottom one layer, at the top another fluid layer. In between there is a thin white layer. This is called buffy coat. And the WBCs are found here only, in the buffy coat. And this is white. That's why this white, in this white region, these sort of cells are there. That's why the name has been given. Will you remember this? Okay. WBCs are nucleated, and all the cells are having defensive functions. I placed one question in your first assessment. What are the functions of each variety of WBCs? Today, nobody could answer. All are answered: phagocytosis, neutrophil, phagocytosis, basophil, phagocytosis, eosinophil, allergic, anti-allergic, basophil, anti-allergic. In this way, you write. But not actually. They are having definitely difference in function. So today you will be learning what their functions. Their normal count, and in children. Okay. Their absolute count and percentage. What is the percentage of eosinophil? 1 to 4%. Basophil less than 1%. And neutrophil 27. Lymphocytes, monocyte. Remember this. Never let monkeys eat banana. N for never, L for lymphocyte, M for monocyte, E for eosinophil, B for basophil. So their count is 60, 30, 6, 3, 1. So in this way you can memorize. Variation in WBC count. What is leukocytosis? Increase in, what is the normal value of WBC count? When you will call it is when a value should exceed some value. What is that value? What is, I mean, the upper limit? Okay. What are the conditions? Physiological condition, and what are the pathological conditions? Remember the pathological causes, because from here you may face MCQs. Then this is leukopenia. Leukopenia means reduction in WBC. How much? Less than 4,000. What are the conditions? Typhoid fever, starvation, viral. I'm having fever. So, blood has been tested. DLC was done. TLC was also done. Now, how can you distinguish whether it is a viral fever or it is due to bacteria? How you will differentiate?
If there is increased number of neutrophils, if there is increased number of neutrophils, then it will be bacterial fever.
Bacterial.
And if there is increased number of
Lymphocytes.
then it will be viral fever.
Is that correct? What she said? Can you repeat? What is your name? Asrusha. You tell what she said. So, it is differential count. What is differential count you could do? These are the conditions. Leukemia, you might have heard this. So, what is leukemia?
Increased number of blood and cells condition.
Did you go through this?
Yes, sir.
Learn this. I will ask later, what is leukemia? Its count should be,
More than 50,000.
not only they are not normal, so they function abnormally. Now the classifications. We classify the WBCs. When we stain the WBCs, we find some cells are having granules, and they took stain. They took stain. Who took? The granules. And if some cells are not having any granules, only the cytoplasm took the stain. That is also what all the cells will take. Cytoplasm. Cell is having cytoplasm. Within the cytoplasm there may be presence of granules. Granules may not be present, but the cytoplasm may take the color. What is this color? Blue color. So within this blue color, there may be presence of different colored granules. The granules may be of different size. Some may be so fine. Some may be fine like sand. Some may be very coarse. And some may be in between. Some may be in between. And color will also can vary. We'll see how they varies, their color varies. Okay? So some cells are having granules. And these granules are classified according to the type of stain they took. According to the type of stain they took. What is the name of the stain we use normally? And what are its composition? Okay. This eosine, whether it is a basic stain or it is an acidic stain. Doubt. No, whether it is an acidic stain or basic stain. Acidic stain. Hello for everybody. It is acidic stain. And the methylene blue, it is basic stain. Now, if this acidic stain, that is eosine, whose component it will stain? This is acidic stain. Now, if any component within the cell is basic, it will stain it. Okay? And the methylene blue will stain. It is basic. So, if anything is acidic, it will stain. So, basic compound within the cell, they will take the eosine stain and it will be red or pink. Okay, but if the composition of any maybe nucleus, within the nucleus some component is there, and in the cytoplasmic granules they may take methylene blue. That means they are acidic. That means these components are acidic. Is that clear? Okay. Now, we will classify the granulocyte according to the color they took, whether they took acidic stain or the basic stain or the neutral stain. Neutral stain means these granules may take both type of methylene blue as well as acidic stain. That's why it is called neutral. So we can classify them into neutrophil, means they will take neutral stain. The granules will take neutral stain, and in case of eosinophil, they will take eosine stain, acidic stain, and in case of basophil, this will take. Okay, and A-granulocytes, they don't have any granules. I will confuse sometime to see with your level of confidence. Okay. So A-granulocytes are not having, they are having cytoplasm, but they don't have in the cytoplasm, no granules are there. That's why they are called A-granulocytes. Now they are of two types. One is lymphocyte, another is monocyte. Again, my question to you. Among these 5 varieties, neutrophil, eosinophil, basophil, lymphocyte, monocyte, again lymphocytes are two types, large and small. Among these cells, which cells are large? I will ask you. Among them, which are largest? Lymphocytes. A lot of RBC will find in the smear under microscope. So, monocyte, when you will be identifying a monocyte, remember this, it should be almost double to triple the size of a RBC. And there also, this set, their nucleus is also large, but indented. Large cell, large nucleus, eccentric. Eccentric means they will be at the side, at one side, and having an indentation towards the central part, that is towards the central part. Central part means towards the cytoplasm, other side. So this is the cell and it will be the nucleus. Okay. So this is, firstly, they are large, their nucleus is indented and eccentric. Okay. So this is the one most identifying character, and they don't have any granule in their cytoplasm. And the small lymphocytes, regarding the lymphocytes, their nucleus is round. Their nucleus is round. The small lymphocytes, in relation to the cell, their nucleus is large. Mostly this nucleus will be occupying most of the cytoplasm. Only thin rim of cytoplasm you will get. Only thin rim of cytoplasm you will get. And they are almost the size of RBC, or maybe slightly larger than this. Okay? So no granules in the cytoplasm. Cytoplasm is very thin. Large part of the cell is occupied by nucleus. Only thin rim of cytoplasm you will get. Okay? And size slightly larger than the RBCs. And the lymphocytes. What are the distinguishing point? They are smaller than monocyte. They are smaller than monocyte. They are also bigger than small lymphocyte. In between their sizes, and the nucleus is also round, eccentric, not indented. No granules in the cytoplasm. Is that clear? So this way you can identify. Am I right? The features I have told you. I am correct, is it? Okay. Next. Okay, no need. Leukopoiesis, actually it is leukopoiesis. So actually the WBCs originate from bone marrow. There are two type of series. One is lymphoid series, another they are committed stem cells, another is myeloid series. From the myeloid series, they are committed. These myeloid series are committed. Committed for they will be producing different variety of WBCs. So one variety, that is B variety, this will produce basophil, and N variety of committed stem cells, they will produce neutrophil. E variety of committed stem cells, they will produce eosinophil, and this variety, M variety, they will produce monocyte. But here, from here you will get what? You will get, this is the lymphoid series, lymphocytes. So they will produce lymphocyte, T lymphocyte, B lymphocytes. And another type of lymphocyte is a nature killer cell, NK cells. Natural killer cells. Color of nuclei by Lichtenstein. Remember this. Where you will find chromatin? Where you will find chromatin? Whether in the cytoplasm or in the nucleus or anywhere else. Nucleus. Huh? Nucleus. Okay. So they will take purple color and the nuclei will take light blue nuclei. What is nuclei? What is nuclei? Hey, what is nuclei?
Singular.
Singular form or plural form? Nucleus is singular or nuclei is singular? Nuclei is singular.
Nucleus is single.
So rectify yourself. Nuclei is plural. A nucleus is single. Okay. So it will take light blue. So forget about chromatin. You will find the nuclei and the color is light blue. And the color of the granules. No, sorry, there is one mistake. It will be color of the granules. Color will be like this. In case of it is neutrophil, purple color, eosinophil red orange, and basophil purple black. distinction of granules by color. Now tell me, I will ask one by one. You, yes, no to you. He is knowledgeable. No, what? Okay, first tell me what variety of WBC it is.
It's a eosinophil.
Eosinophil. That variety is eosinophil. You?
Granules.It.
Sit. You? We told there its color is bluish black. And another important characteristic he told, you cannot properly identify the margin of the nucleus. Why?
Due to the presence of that.
Because the granules, they are covering the nucleus. Very good. Sometime in reporting, pathological in report, in blood report, if disease differential count is there, instead of neutrophil, they will be writing there polymorphonuclear leukocyte. Okay? So remember this. Size. What is the size of RBC? What is the size of RBC? What is the size of RBC?
7 micrometer.
What?
7 micrometer.
7. Okay, good. Sit. Young neutrophil, how many nuclei they will be having?
So in case
Young, just born.
just one there will be less number of the less lobe will be present in the young ones, and as they grow older, they will multiply.
In young one, the nuclei may be S-shaped, C-shaped, not SS, C-shaped or band-shaped. It will be a band like this, band-shaped. Okay? Horseshoe-shaped, young neutrophil or band neutrophil. This band-shaped nucleus having band-shaped nuclei, neutrophil, so they are also called band neutrophil. Single nucleus. Okay? So there may be 2 nuclei, that means age is increasing. Okay, 3 more, 4 more is, and 5, 6 they are senile, means they are going to die. They are aged. What is Arnett index? What is Arnett index? Who can tell?
Unable to yes.
Arnett index. A-R-N-E-T-H. Arnett index. It is like differential count. But here 100 cells will be of neutrophil. If you study 100 neutrophil, then among this 100 neutrophil, some will be having 1 nucleus, some will be having 2, some will be having 3, 4, 5, 6. So percentage composition of different lobed neutrophils is called Arnett index. It may give you, if you plot a curve, this is the number, this axis of the curve, y-axis, x-axis. In x-axis, what is their number of lobes? And here you are putting their percentage composition. 0%, 10%, 20%, 30%, this way. So now you will find how many cells are there out of 100? How many cells are there with one lobe? You will put a dot there. Then with two, if you put a curve like this, you will get a bell-shaped curve. And if this you get the bell-shaped curve, it will indicate the number of cells generating and number of cells dying are same, and this shape is normal. Bell shape is normal. No infection is there in the body. No, not that. Sometimes you will find the curve is like this. And what does it signify? Curve is like this. Curve is like this. Number of new cells are more and number of old cells are relatively less. That means body is infected. Body is, recent infection is there. That's why body is trying to get rid of it, producing lot of new neutrophils. So that's why this shape is important also. And if you get the curve like this, new cells are less and old cells are more. New cells are less, that means the neutrophils are dying, but less, not in that rate. The death rate is more, but their production rate is less. Bone marrow is not working properly. There is reduced leukocytosis. You got the significance of Arnold count? Okay. You have seen this? Trilobed. Here it is bilobed. It is band. Neutrophil, but band. Okay. And here how many lobes are there? 1, 2, 3, 4. 4 lobed. The granules will take what type of color? Blue. Bluish color. And the granules is, what type of granule it will be? Fine granules. Sand-like. Okay. Fine granules. And color of the granules given in black. Granules are purple in color. Cytogranular, slightly cytoplasm having granules, and the color of the cytoplasm is bluish. I said cytoplasm is different from granules. So this cytoplasm will take uniformly in all cells blue color, but their granules may take different colors. They are called neutrophil because they take both type of stain, acidic stain, basic stain. And these granules are having lot of chemicals, lot of enzymes, because they will be phagocyting, they will be destroying the invaders, organisms. So that's they must have some weapons. Okay, these weapons are nothing but enzymes, different types of enzymes. They also liberate histamine. They can also liberate to some extent histamine. Histamine is, see their lifespan. Only, they can survive only 6 to 30 hours. 1 day. Their survival is 1 day. What is happening to this? Every day, lot of lymphocytes are dying. What happens to those lymphocytes? Did you hear the name of macrophage? What is their function? Shokun, vulture. What is what they do? Whether they are protecting our ecosystem or our environment. Crow. Whether they are helpful for us. Crow. Or harmful for us. Helpful. How they are helpful? Crow. Great.
They feed on dirty.
What do you do? Leftover food you throw in the road? They use it as their food. So they are cleaning. Like culture. So they are phagocytosed by, they are engulfed by the macrophages. Neutrophilia, more production of neutrophils. What are the conditions? Acute pyogenic bacterial infection. Production of neutrophil. What are the condition? What is, I want to know what is aplastic anemia. What is aplastic anemia? Aplastic anemia. Bolo. Aplastic anemia.
Sir, it is a condition in which body stops producing new cells.
Who starts?
Body stops producing
New
cells.
Why? Your bone exposed to, for example, exposed to radiation repeatedly. What will happen to the bone marrow? If the bone marrow exposed to radiation or any drug you have taken that may destroy the bone marrow, what will be the consequence? Bone marrow producing different kinds of cells, so they will not be producing those cells. Even the WBCs, even the RBCs. So RBC production will be there. This condition is called the aplastic. Okay, because of there is loss of bone marrow because of exposure, and as a result, what will happen? What will be the consequence? Less production of different types of WBC. So there will be RBC production, less RBC production. This will create anemia. This sort of. It is called aplastic anemia. Degeneration or of the bone marrow. Neutropenia. In neutropenia, neutrophil count percentage will be less. Their production will be less because of viral infections like measles, influenza. Drugs like chloramphenicol. In fever, what happens? Pyrogen is produced. And it affects our thermoregulatory center in hypothalamus. In hypothalamus, we have two centers, anti-rise center, anti-drop center, temperature. So, this center actually balances or brings the temperature keeps the temperature to a normal range, normal level. So if the function of the hypothalamus, this function is disturbed, then what will happen? Disturbed means here function of anti-rise center is suppressed. As a result, there will be raised temperature. Can you name one antipyretic? Antipyretic drug. Everyone is using frequently. Paracetamol. Some students could answer. Paracetamol. Neutrophil phagocytosis. So how do they phagocyte? So there are steps. One is chemotaxis. A bacteria invaded my skin. First invaded, and here it will attack the cells here. So during these, the bacteria, they will release some chemical, and some cells of my body is damaged, they will also secrete some chemical. They are called chemotaxin. These chemotaxin are like perfume. Where from this perfume is, this smell is coming? It can be sensed by the neutrophils. Neutrophil can sense it. Okay? So, what happens then? After sensing these chemotaxin, they marginalize. So, this is the blood. Blood is having neutrophils. They will stick themselves on the intima surface, and this is called margination. They are marginated along the, what is this inner layer? Endothelium, inner endothelium. So this endothelial layer, in the endothelium they will be marginated and where it is gone? And pavmenting. Pavement, there is the pavement. So they will take the pavement. Then what will happen? Diapedesis. In our last class we have described the capillaries. Some are tight. Only the cells are having pores. And some are having in between cells there are gaps. So here the cells of the endothelium, they are having gap. And through this gap, fenestrations are there in between the endothelial cells. So through this fenestration, they come out of the blood vessels. And the process is called diapedesis. We know they can change their shape. They can change their shape. By changing their shape, they come out through the process of diabetes and come to the affected area. Then what they do? Hey, this is the bacteria and it is the neutrophil. So, okay, before I eat it, I have to opsonize it. I have to make it tasty. Oh, now it will be delicious. Add some salts, add some sugar, add some. Huh? Huh? Then only it will produce pseudopodia and engulf and produce a vesicles. And these vesicles will be attached within the cell. There are lysosomes. Lysosomes are having lot of enzymes, digesting enzymes. So lysosomes will be released into the vesicles. Now what will happen to the bacteria? Kuch karke killing. Okay. So this is the process of phagocytosis. What are the steps?
Chemotaxis, margination and pigmenting, diapedesis,
Okay. So this is the process. Now the eosinophils. Size, their size, nucleus bilobed, spectacle shaped, you have already mentioned. Usually two oval lobes connected by a thin chromatin thread, already told, and they are nucleus is purple, cytoplasm acidophilic, that's why this acidophilic, philia, likeness, phobia, don't like, philia I like. So they like acidic stain, that's why they are called acidophilic. And when the stain take the eosine color, the grains take pink color, red pink color, bright red color. Okay. Granules also, here granules contains, these are the things this granule contains by which this is their weapon. With this it will fight. When it's attacked, it releases these substances, thereby it attacks. Whenever you find the bacteria is so big, so it is not possible to engulf it. Its size is less, bacteria size is more. So in that case, it will some toxin that will destroy the membrane of the bacteria, then the bacteria will be killed. Now you can see the red colored granules and bilobe, thin chromatin, and here distinct chromatin is not there, some variations are there. So these are the variations. Here look, so there is no variation, here some variation is there. But this link is there. Is that clear to you now? No. Now you can identify eosinophil. Confident. These are all eosinophils. Now their functions. Take the photo. See the functions. In malaria, what happens? Histaminase. Histamine is allergy producing, but histaminates, it prevents. By destroying histaminate, it destroys histamine. Thereby, what will be its function? Anti-allergic. Okay. Eosinophilia, what is eosinophilia? When it is seen? In allergic reaction, bronchial asthma, allergic rhinitis, sneezing, right? So repeatedly sneezing, repeated sneezing, frequently, day after day. So, parasitic infections like filarias, ascariasis. It is ascariasis, so everybody has faced. Eosinopenia, less production of eosin. It is seen in glucocorticoid therapy, Cushing syndrome. Glucocorticoid therapy. Steroid therapy you have heard the name. So glucocorticoid is one kind of steroid. When kidney is transplanted, some patient's kidney gone. Okay, so it has to be replaced. So donor has given one kidney after testing so many things, then it is transplanted. So before and after transplantation, lot of steroid therapy is given, and it continues even after transplantation. Why? This steroid suppresses immunity. Suppresses body's immunity. As a result, the kidney which came from outside, our immune system cannot identify it as a foreign body. Since immune bodies, antibodies are suppressed, production of there is suppressed. So now there will not be any antigen antibody reaction, means kidney is not antigen to the antibodies present. So as a result, kidney will be there. By this time, what will be there? There will be genesis of blood vessels, angiogenesis. Unless there is angiogenesis, how the kidney will get, from where kidney will get its nutrient? From where it will get its, though blood supply is connected, the artery, renal artery, renal vein, they will be connected. They will be connected. Even then, some within this kidney, there should be angiogenesis. Even after this. Okay, so why it is given steroid to suppress the immunity of the body. So if you might have seen, and they are transplanted kidney patient, always they use mask, isn't it? Why? Because they are now susceptible to any kind of infection, so that they are not infected through the inhaled. So in the environment there are a lot of virus, bacteria, so they are not even they are to protect from since their immunity is very poor. So in such case, protection should be there. What happens in AIDS patient? You have attended this. How the AIDS patient die? The patient die, no? So why they die? What happens to their body? Body's immunity is lost. As it is simple infection. Basophil. They also liberate anticoagulant, heparin. They release histamine. So they will produce anaphylactic reactions. Variations, basophilia is seen when basopenia is seen. Lymphocytes. Two types, large lymphocytes, small lymphocytes. Nucleus single, big, purple colored nucleus, round, oval or indented. In case of large one, it may be slightly indented. And central in position and occupies whole of the cell, having marginal cytoplasm at one end of it or all around it. Nuclear chromatin is coarse and lumpy, forget it. Cytoplasm pale blue, as said, it is always blue.
What does scanty means? What does scanty means?
Scantiness.
What does that mean? So what does that mean? So what does that mean?
Scanty cytoplasm. Because here, what is the functions of this? Lymphocytes. When they are produced, scanty, they are going to divide. They will be defined from there, will undergoing transformation at the cost of the nucleus. Say that large lymphocyte, there may be slight indentation, and it has a small lymphocytes. Function. Beta cell will attack invaders outside the cells, and T cells will attack infected cells, dying cells. I think you know that. These are the variations.
Leukocytosis,
Monocytes. See, their diameter can increase up to 18. Near about triple, 21. 7 3s are 21. Nucleus single, round, indented, eccentric, pale staining, cytoplasm pale blue,
clear,
as usual, and their functions. See, their life. While they are in circulation, their life is less. 10 to 72 hours. But they can come out of the cell by diabetes, enter into the cells. Then they will transform themselves into macrophage. Okay, now they can live for about 3 months. But do you have any idea what is septicemia? You have, and others don't have. Tell them what is septicemia. Infection, and throughout the body, almost all organs are affected. As a result, ultimately, what is the organ failure? When somebody will be suffering from septicemia, then chance of
Dying.
living is very poor.
Yes. Ventilator.
These ventilators are another source of infection. ICU is a great source of infection.
Yes, sir.
You will find somebody had no infection, but when entered because of cardiac trouble, he entered there. Ultimately, their septicemia developed. What was the source? ICU is the source. Well, there will be intubation, and it is another great source. Catheter. Insertion of catheter, that is another source. So you should be careful about this. These are the sources. Catheterization, you have 1 hour time. So by this time you will be making a smear, blood smear. And how to make? This is the step 1. This is one slide. So you took 1 drop of blood. Now you bring the slide towards this so that it touches with this blood. Now it is touched. Now it will be there. It will be spreaded along the margin. Now you will be pushing it. You pushed it, so you got the fill. Okay, what is the angle? 45-degree angle. Okay. Suppose this is one slide, and here is the drop of blood. Now this is another slide. What to do? This way or this way?
This way, this way, this way.
This way. Wrong. This way or here is the drop. If it is here, move it like this. It is the drop. Now bring it closer to it.
Make it spread
Move it like this so that it spreads the margin. Then you push it. And now they are tongue shaped. Then what do you have to make it dry?
After that, Leishman stain.
After that, you have to add Leishman stain. And what are the? Then you will after Leishman stain, 8 minutes. What will be happening during this period? Fixation. Yes, 2-minute fixation. Okay, now you understood what you have to do first. Your slide has to be clean and soap water must be there. So with soap water you clean it, then you do it.
इस साइड में कोई और नहीं आ रहा क्या कुछ है फिलअप करो
Let me wash.